Hello and welcome to WorldCanvass from International Programs at the University of Iowa. I'm Joan Kerr and we're coming to you from Film Scene in downtown Iowa City. Thank you for joining us. Tonight we take on a complex and controversial topic, tobacco, pot, and the public interest. We'll explore issues surrounding the legality and use of tobacco and marijuana with a special focus on the tension between personal liberty and the public good. Before we start tonight's conversation, I'd like to invite you to come to these live shows if you're in Iowa City and you'd like to join us for the live discussion. We'd love to have you. Or you can catch them later on UITV, on YouTube, iTunes, and the International Program's website, which is international.uiowa.edu. You can learn more about Film Scene at icfilmscene.org. Tobacco's characteristics, its allure for smokers, its addictive qualities and harmful health effects, and the legal but regulated status are well known to most Americans. In fact, over the last quarter of a century or so, thanks to massive public education efforts, we've seen a sharp turnaround in public attitudes and private behaviors regarding tobacco, largely because of the recognition that smoking tobacco dramatically increases health risks to smokers and non-smokers alike. This reversal has been, I think, something of a public health success, aided by the establishment of legal limitations on the sale and marketing of cigarettes, laws prohibiting smoking in public spaces, and both voluntary and legislated restrictions against smoking in restaurants and establishments. Nonetheless, tobacco remains, as it has always been, a legal substance for adult use. So let me introduce my guests who will help us understand both the history of tobacco use and its hold on generations of smokers. Directly to my left is Christopher Squier, Director of the Oral Sciences Training Program at the University of Iowa College of Dentistry. Thank you for being here, Chris.
Thank you, Joe.
Next to him is Douglas Beardsley, Director of the Johnson County Public Health Office. Doug, thank you for being with us. Appreciate it.
Thanks for asking.
On the far end, we have Dr. Robert Philibert from the University of Iowa Department of Psychiatry, professor here at the university. Thank you for joining us, Robert.
Thank you for having me.
So, Chris Squier, let me just start with you. And I know you've been deeply involved in research into tobacco use here in the States and all over the world. You are, after all, Director of Global Health Studies here at the University of Iowa as well. So I wonder if you could walk us through the history of tobacco use and what some of the deleterious effects are for those who smoke and even those who don't.
Okay, Joan. It's nice to be here. And the story of tobacco, the history of tobacco is really an American story. If we go back 500 years, time when Columbus came to this continent, there was only tobacco in the Americas. It had been there a long time. Tobacco has been used in the Americas for probably 3,000 to 4,000 years. Earliest traces of it are in South America, where they cultivated it. They used it in different ways, including smoking it. And it gradually moved up Central America, probably 2,000, 2,500 years ago, evidence for its use, and then into North America about 1,800 years ago. So during all that time, no one else in the world knew about tobacco. It all changed, as many things did, after Columbus and the first voyage arrived. And they saw the natives using tobacco. It intrigued them because they were using it in different ways. It was chewed, it was smoked, it was rubbed on, it was used as an enema. It had medicinal uses, or so they believed. But above all, of course, it was good to smoke and to chew because you got the nicotine, you got the addictive agent, and you became addicted. They took it back to Europe initially. And the remarkable thing is, within 200 years of it being taken back to Europe, it had spread almost everywhere in the world and was being grown, being cultivated and grown in most of the rest of the world. So for 3,500, 4,000 years, nobody else knew about it. Then within a few hundred years, the whole world knew about it. And it was used in slightly different ways from the way we see it now. It was smoked, pipes, cigars. It was chewed, the way it's chewed sometimes now. But there were no cigarettes. And what changed that was the invention in the late 19th century of the automatic cigarette machine, the machine that made cigarettes very, very rapidly. There had been some use of tobacco wrapped in paper. The French did that to some extent. Much smaller, much thinner than cigars, easier to use. But a man called Bonsart in 1883 invented this machine that could make cigarettes many, many times more rapidly than hand rolling them. So the big thing there was the price dropped. They became a very affordable product. And of course, use escalated. And that was where we saw incredible increases, particularly in this country, because after all, this is where tobacco was developed. And you had a young man called Buck Duke who saw the possibilities, licensed the cigarette machine, in fact manufactured a lot of them, set up a cigarette business, and Duke eventually made enough money to be able to endow Duke University, the university we think so highly of, but was founded on tobacco profits. But it was also spreading across the rest of the world. And yet, nobody was aware really of any problems with using tobacco, partly because people were suffering from many other things. For example, if you get a cancer from tobacco, a lung tumor, one of the most commonest cancers you get from using tobacco, that can take 20 to 30 years before it's evident, before it may kill you. Well, people were dying from infectious disease and other things well before they got to that age. So it didn't become evident, but there were some early indications, some work in Germany in the 1920s, and particularly work here, actually at in St. Louis, showing this increasing association between people that were smoking and lung cancer. Until that time, so now we're talking about 1940s, lung cancers were a fairly rare lesion. They increased dramatically, and it almost always seemed to be in smokers. And so you got the first inkling that maybe tobacco wasn't that good for you and perhaps could be quite bad for you. And a lot more work was done then in the 50s. Now, with the first suggestions that this could kill you, this could cause serious disease, this could kill you, the tobacco industry started doing what it did then for 60 years or so, denying the evidence, stating that there wasn't enough information, more research is necessary kind of statements, and trying to reassure the public that they didn't have to worry. Well, they did, because people were then smoking at a greater rate and beginning to die at a greater rate. And so finally in 1960s, 1964, the Surgeon General put together all this evidence in the first Surgeon General's report on smoking and lung cancer. And that was something of a bombshell, because it got a lot of attention. It certainly got the tobacco industry's attention, and there were the first attempts to warn people. The first labels were mandated for cigarette cartons, which said, smoking may harm your health. I mean, it was about as wimpy as you could get in a warning notice when you think about now smoking kills. But that's because of the opposition from the tobacco industry. But it had an effect. They took advertising off electronic media. You couldn't advertise tobacco, cigarettes on TV or radio after the 60s. And there was a tax increase. It was about the last time there was a serious federal tax increase. And you have to note that after that time, the federal government did very little in the area of tobacco control. Most of the initiative passed to the states. And the things that we're now aware of, higher taxes, smoke-free laws, mainly have been enacted, almost totally have been enacted at the state level. But it did mean that people began to think about smoking, began to stop smoking, so that probably the peak of male smoking was in the 60s. And since that time, it has dropped to the present day. It's probably half the rate. Over 50% of males smoked in the 60s. Now the figure is somewhere down below 20%. So that had an effect. Now the tobacco industry did something very subtle and quite disgusting. If men were smoking less, what about women? Women had been smoking less. It wasn't something that a lot of women did. They started promoting tobacco use to women, and some brilliant campaigns. I mean, insidious, evil, but brilliant, such as "You've Come a Long Way, Baby." Some of you have probably heard that. Absolutely brilliant. I mean, they were matching cigarette use with empowerment, sex, that's right, with the entry of many, many women into workforces. And it worked. Women started smoking more as men started smoking less. And right now, we may be past the crest of female smoking because their rates are going down. But their rate of lung cancer is still going up. And a few years ago, it exceeded deaths from breast cancer among women. But the tobacco industry had another trick. Okay, if people were dying or quitting in this country, they had to find fresh customers. And they moved out to other countries. They moved to the developing world. And as countries became prosperous enough to afford their manufactured cigarettes, and you have to remember that Western cigarettes, the Marlboros and so on, cost more generally than local cigarettes. So as countries became able to afford to buy them, they moved in. A bonanza occurred with the collapse of the Soviet Union, and they went into many of the newly independent Soviet states, Soviet country, they're now independent countries, and started promoting tobacco on the basis that you could make money off it, governments can tax it, it provided employment, they did amazing sales jobs to get tobacco into these developing countries. And that is still going on. As nations become a little more prosperous, tobacco is being pushed. Africa's a big focus at the moment. Southeast Asia, smoking rates have gone up quite considerably. And what we now have is a global epidemic. Last year, 2 years ago, probably 5 million people died worldwide. So, to put this in perspective, still in this country, 450, 480,000 people a year are dying prematurely from using tobacco, from smoking primarily. But worldwide, it's 5 million. And as rates go down in this country, they are still going up globally. And so we haven't reached the peak of this global pandemic. And the tragedy here is that the countries least able to deal with such burdens are the developing countries. They don't have the budgets to provide the health care, and they have already a lot of other problems. So this is a very cruel issue that's occurring. So we still have to look at ways of dealing with the global epidemic. If we come back to this country, as I said, the number of people smoking has gone down. It's about 19% overall the population across the country. Slightly, about 18%. Iowa's higher than that. Unfortunately, smoking rates in Iowa, having come down fairly dramatically, are now beginning to creep up. Smoking rates among high school kids are beginning to edge up. And this is partly because of a backing off in the area of cessation, publicity, public health, in fact. People believe we've beaten tobacco, smoking rates are going down, aren't they? Don't realize that the moment you back off, the tobacco industry is in there promoting tobacco. It spends, for example, about $90 million a year in promoting tobacco in the state of Iowa. I don't know if anyone knows what the budget for tobacco prevention is in the state of Iowa to the IDPH. No, you're not allowed to answer that. Well, it's currently 3 million. So who's winning? So this is one of the issues we've got to address, this continued smoking, let alone the global situation. And this really brings us to approaches to helping people to quit, and that's public health. And so I think this is a time perhaps to turn to Doug Beardsley, who is Director of Public Health in Johnson County, an expert in this area, and to give us a perspective on public health and cessation and smoking.
I'm cautious when you're called an expert on something, because then people expect you to know a lot of things. But from the public health perspective, just a little bit, people turn, well, what is public health doing about it? Public health historically has always been about protecting the general populace, so as groups of people. Started off early with quarantines. The United States government did quarantines because they saw that there were things coming in, whether it's products or people, that needed to, we needed to take care of that so it didn't cause harm to others. And then as Dr. Squier mentioned, as public health was very successful in controlling communicable diseases and infectious diseases, then it started to creep out. People are dying. Now what are people dying of? And it's the chronic diseases. And then going back and what are the root causes of those? Tobacco just always came back up to the top. Even before the Surgeon General's report, it was intuitive. People knew cigarettes aren't good. I remember seeing old movies done in the 30s where they're talking about you shouldn't be smoking because it takes away your wind, talking to an athlete. So they recognized there were ill effects. Some of the tools that we've used in public health, again, it's to affect populations. So affecting access, laws that, who can purchase. Under 18, we restrict purchasing, possession, or use, and that varies by state. Taxation to help get that price up, because that's, again, an access issue. Although we see that it's the lower income populations who have the higher rates of smoking. So there's a little bit of a dichotomy, something that's not working there. And I think a lot of that is the targeting through the tobacco companies. And also there's just how do we help people who are addicted to get off? And I think we'll probably hear more about that. One of the things that is of concern now, though, is we talked about, Chris mentioned the tactics of the tobacco industry. And they're not sitting still. They're finding other ways to addict new users to the product. One of the new things coming out are e-cigarettes, the electronic cigarettes, which, if you saw any of the advertisements, totally harmless. It's water vapor. Well, it's not water. It's vapor, but it's not water vapor. And so some of the things we know about that is they still contain nicotine. It's still addictive. Some of the things we don't know is it really a gateway? Is it going to, if someone starts on e-cigarettes, are they going to then use tobacco? We do know that a large proportion and a growing proportion of our youth who've never used tobacco are getting hooked on e-cigarettes. We know that people who are currently smokers are dual users now. They say, well, let's try this out. And it may have been a well-intended, and I think the original researcher was looking for a way to help smokers get off this, but it was, again, taken over, bought up by the tobacco industry. But that gets us into the realm, we're looking at ways, well, how do we reduce harm? If we can't eliminate it, it would be great to eliminate tobacco use, because there really is no safe level of tobacco use. There's no safe level of exposure, like we see, OSHA establishes standards for exposure. There's no safe level for tobacco smoke. We don't know yet if there's a safe level of exposure to e-cigarettes and the vapor. Some of the ingredients in there, some of the same ingredients in e-cigarette to vapor that there is in tobacco smoke. So still a lot of questions, and we're promoting, let's go about this cautiously. Let's not get a renormalization of smoking behavior in the public. We've made these great strides, but now we see starting to take a step backwards, say, let's light up in the theater with an e-cigarette. It's safe. We're not quite sure. Some of the early studies do show that the non-smoker is still absorbing some of those chemicals. You can actually detect nicotine in the non-smoker. So public health does, we are looking at ways to continue to address tobacco use.
Well, you know, we've mentioned addiction more than once, twice. We've been talking about cessation as well. And I know, Rob, that you are a psychiatrist and you do research on things like addictive behaviors. What can you tell us about tobacco?
You know, first of all, I always like to get away from the term addictive. Addictive has a pejorative connotation. When we think of an addict, we think about people that are willing to break societal rules to do things. And the vast majority of people that are trapped with cigarette use are actually what we like to call dependent. But more to your term here is that as far as the looking at the steps we need to do to address this, we have to attack it at a number of levels. Certainly, you know, my specialty is the biology, and through the large collaborations we have, funded very generously by the National Institutes on Drug Abuse and the National Institutes of Health, we're taking a look at epigenetic mechanisms that can be used to detect, prevent, and treat tobacco dependence. The same technologies, the question is that can we grasp the biology of this dependency a little bit better to help people say which approach would help you quit. But I don't think that any approach in isolation can be used because any type of dependency is contextual. And the behaviors that happen in one environment do not happen in other environments. And so there has to be a consistent pan-society effort from the medical community, from the public health community, from the educational community, and from the community at large to stop smoking. And more importantly, it gets to the point that Dr. Squier pointed out. The tobacco industry is spending $90 million in Iowa to promote smoking. You get a small chunk of change of $3 million. And somehow we have to flip that to make it make it clear to the people that are trapped in the biology of this dependency that it is not only in their personal, their professional, but only in their business interests to stop smoking. And indeed, it's in all our interests that they stop smoking.
Yeah, and you know, we have seen at least one national corporation, CVS, declare and publicizing this all the time that they will not sell tobacco any longer in their stores and in their pharmacies for reasons that they explain. I haven't seen lots and lots of other pharmacies step forward and say that they're no longer going to sell tobacco, but you know, they say we can't in good conscience sell something that we know is so bad for our customers. What was your reaction to this when you saw this happen?
Well, we were happy, and actually I took that to the Board of Health, and we wrote them a letter saying, thank you, congratulations. And I don't know how this, I think how this fits in is, you know, again, public health, we're trying to create the environment where there are incentives. So somebody is thinking about, you know, I really do need to quit, and urge them or nudge them to seek the help, whatever it is most effective. So, you know, again, the access, you know, if it's just so inconvenient that eventually someone realizes, you know, it's better for me to quit, either through cost or, you know, I have to go outside and smoke in the blizzard, you know, and hopefully there'll be you know, that aha moment that, you know, maybe I should seek some help. If that helps.
Are you encouraging blizzards?
If you're properly prepared.
What are some of the best cessation tools, do you think? Obviously, you say that it takes many, you have to attack it in multiple ways in order to help someone.
The best one is support.
Yeah.
Far and away. We can address the biology of it, but the thing is tobacco is a dependency. And like any illness, we don't treat people, we treat families, we treat communities. And probably the best thing you can do for any smoker is, how about an attaboy? How about simply an attaboy? How about a congratulations? How about saying, you know, you haven't smoked in a year. That's great. and talk about the positive influence that has on a person's spouse, on their family, on their children. So there's a lot we can do for medications, but the best thing you can be is simply be a human being.
Well, thank you. That's a great way to start off this program. I appreciate it so much. Next to me here, Christopher Squier. Next to him, Doug Beardsley and Robert Philibert at the far end. You'll see some of these guests in future segments. So I hope you can stay with us for part 2 in this series when we'll look at marijuana or cannabis, the properties of the drug, potential for addiction, and changing public attitudes toward the use and the regulation of cannabis in both recreational and medicinal forms. So that's coming up in just a moment here. All WorldCanvass programming is available on YouTube, iTunes, UITV, and the International Program's website, which is international.uiowa.edu. And to learn more about Film Scene, you can go to icfilmscene.org. I'm Joan Kerr, and for UI International Programs, thanks very much for joining us, and we'll see you next time.